Good morning friends, welcome to our next learning session, and today I am going to talk about thyroid disease called hyperthyroidism. What is thyroid gland? Now see this diagram and you will understand the thyroid. Where is thyroid gland? Thyroid gland is located in the neck in the center. See in this diagram, I don't have to explain much. This is the face, you can see it. This is the mandible. This is the mandible. That is the lower jaw, and this is the collarbone. Below the collarbone, you know, it is the chest, and above the collarbone and below the lower jaw, it is all neck. So in the center of the neck, you find this thyroid gland. See, this is the thyroid gland, and you see it has got two segments, one on left side, the other on the right side. This is called a right lobe of thyroid gland, this is called left lobe of thyroid gland. These two lobes are joined together by a small piece of thyroid tissue. It is called isthmus of thyroid gland. This is called isthmus of thyroid gland. This is the thyroid cartilage, and this is the cricoid cartilage. This is the windpipe. So from here the air comes through this windpipe, goes to the lungs for our respiration. So having known the position of the thyroid gland in the chest, we now go to little more of anatomy of thyroid gland. Now see this diagram. Again, thyroid cartilage, lobes. See, this portion is the right lobe, this portion is the left lobe, and this is the neck. Okay, and this is the isthmus of the thyroid gland. This is the windpipe. See, this is windpipe, this is isthmus, this is right lobe, this is left lobe, and this is the thyroid cartilage. This is the neck. This I have marked here. This is the neck. Another diagram to make you conversant with thyroid gland. This is the neck. Here we left the portion of the jaw. This is the windpipe. This is just in front of the windpipe in the neck. Just in front of the windpipe. See, this is the one left lobe. This is the right lobe of the thyroid gland, and this is this entire is the thyroid gland. This entire portion is the thyroid gland. This is the thyroid cartilage. This is windpipe. Will tell you in signs and symptoms of this, and one of them is this palmar-erythema. I thought I'd show you this diagram here at this moment. See this reddish spots you are seeing on the diagram. See, this is here, 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 and here on both sides. You see, this is at the root of the thumb, and this portion is at the root of the little finger. You see this portion. This is called thinner eminence. This is called hypothinner eminence. So these are reddish points, like pinpoints, reddish pinpoints picture. This is because the capillaries and arterioles in the skin become dilated, and they give it appearance of redness and palmar-erythema. So this is another diagram. If you have not paid attention, now pay it again. This is I will quickly go over. This is the lower jaw. This is the clavicle. That is the collarbone. This is the thyroid gland. This is isthmus. This is the thyroid cartilage. This is the cricoid cartilage. This is the windpipe. Now, what is hyperthyroidism? Increased secretion of this thyroid gland is gives rise to certain symptoms. This condition is called hyperthyroidism. The thyroid gland produces two hormones, T3 and T4. In fact, the function of the thyroid gland is to concentrate iodide in the thyroid gland, and this iodide is coupled with an acid called, making it a monoiodothyronine. It is a Thyronine is an amino acid which combines with iodine, forming monoiodothyronine. Then the two combine to form diiodothyronine, and then the one more combines to make it triiodothyronine. Triiodothyronine is also called T3. It is a hormone, active form of hormone, and then one more is added to make it tetraiodothyronine, which is the T4 hormone. So when it comes to measuring the hormones, we measure T3 and T4. Remember, it is T3 which is the active form of thyroid hormone. The thyroid secretion is controlled by another hormone called thyroid stimulating hormone, which is called TSH. We measure it when we ask for thyroid test, and this comes from the anterior pituitary. And the anterior pituitary itself, this TSH is controlled by another hormone which comes from the hypothalamus. This is called TSH releasing hormone. So hypothalamus produces TSH releasing hormone, which goes to the anterior pituitary and causes release of more TSH. This more TSH goes to the thyroid gland and stimulates us to produce more T3 and more T4. If the level of T3, T4 in the blood becomes high, the message goes to the hypothalamus and anterior pituitary to produce less TSH. And if the levels becomes less, then again message goes to produce more. So it is opposite thing, negative thing. It is called negative feedback mechanism. But those who are not doctors, they need not bother about it. For them, it is sufficient to know that thyroid is controlled by TSH. That is why we measure the TSH when doing thyroid function tests. So the hyperthyroidism is 8 to 10 times more common in the females as compared to males, and it usually occurs between 20 and 40 years of age. Though no age is immune, it can occur at later age also. But if the TSH is within the range of 5 to 10 microinternational units, but T4 and T3 are normal, then we call it a subclinical hyperthyroidism. How do we recognize hyperthyroidism? The patient usually has got is hyperactive. There is hyperactivity, there is irritability, there is something called dysphoria. Dysphoria means a feeling of weakness, feeling of unhappy, feeling of being sick. There is a lot of sweating, the hands are warm, and there is a fatigue and weakness, and the appetite is increased. There is a marked loss of weight, and there may be diarrhea, or there may be 3-4 loose normal motions. There may be polyuria and loss of libido, oligomenoria, and as I said, too much palpitation. If we examine the person, the pulse rate is fast, the heart rate is fast, we call it tachycardia. Tachy means fast, and cardia is concerned with the heart. This tachycardia in the elderly may manifest as atrial fibrillation, and there may be tremors, fine tremors of the outstretched fingers, and there may be visible enlargement of thyroid gland, which is called goiter. Visible enlargement of thyroid gland is called goiter. The hands are warm, moist, and there is a proximal myopathy. There is a weakness of the movements of shoulder, particularly, for example, in ladies, combing of hair becomes difficult, and patient may come and tell you that I have this difficulty. Because it is proximal myopathy, the patient may be finding difficulty in getting up from the sitting position. If you look at the eyes and tell the patient to look downwards, the lid doesn't move along with the eyeball, it lags behind. You can see the upper part of the if you see normally your cornea, the upper part of cornea is covered by the lid, but in these patients you may be able to see the sclera, and if you tell the patient to move down, more sclera will become visible, more part of the white of the eye will become visible. So the lid may be retracted, lid may become lag behind one movement, and there may be gynecomastia. There is a fast rapid pulse rate. The blood pressure may become high or maybe in the upper limits, but the lower blood pressure becomes low, much lower. The difference between the upper and lower blood pressure is marked. This is called wide pulse pressure. So hyperthyroidism is one of the causes of wide pulse pressure. Remember this thing. The cardiac output is increased in these patients. The heart is ejecting more blood, and when these patients develop heart failure, we call it high output heart failure, because the cardiac output is high, still the patient is heart is not able to meet the demands of the body, so we say high output cardiac failure. Now these patients can develop coronary artery disease at a rapid rate. Their disease is severe, and because this is causing increased heart rate, which increases the need of the heart for oxygen, which when they don't get which can cause problems in the form that the normal atherosclerosis doesn't allow the blood to go to the cardiac muscle, and the patient complains of pain in the chest. So these patients may have coronary artery disease, they may have cardiomyopathy, they may have heart failure, they may have arrhythmias, and they may be cardiac arrest, and most common cause of death in these patients is the cardiac death. Cardiac death means death occurring death of the heart due to some sort of injury to the heart, whether it is lack of blood supply or it is a disorder of the rhythm of the heart. So most of these cases are because of this thing. A common arrhythmia is atrial fibrillation, which is quite common in patients who are elderly females. So friends, some more than 55 years back, I saw a patient, a female patient who was in her early 60s, and she was restless, she was anxious, her hands were trembling. I said they fine tremors, but here the hands were shaking like if she will hold a cup and saucer, they will make a rattling noises. So marked were the tremors of the hands. Her restlessness was so marked that she couldn't lie down in any position. She will sit up, she will lie down, she will change things. She lost tremendous amount of weight. Also, she was not able to comb her hair, but surprisingly, the thyroid was not enlarged. The eye signs were also, there was no proptosis. See, when I reviewed the hyperthyroidism, I found that about 4% of patients with hyperthyroidism do not have goiter. Similarly, not all patients have myopathy, but some patients do have proximal muscle myopathy, which my patient had. I saw another female patient, elderly female patient, who had irregular heartbeat, and when I examined, I found that it was an irregular heartbeat, and I did the ECG, and this patient had atrial fibrillation. So the cardiac effects of hyperthyroidism are different type of arrhythmias, coronary artery disease, cardiomyopathy, heart failure, These are the important cardiovascular effects. These patients may have hypertension also. Some of them they do have. There may be left ventricular hypertrophy also because of hypertension and coupled with thyroid problem. Now, if the how do we confirm the diagnosis? We do the thyroid function test. We do TSH, we do T3, T4, and we also can do free T3 and free T4. What does it mean? The thyroid hormone T3 and T4 are combined with the protein, and therefore they cannot be active, they cannot be used. So therefore a part of this hormone is released from the protein, and that as our purpose, that is called free T3, free T4. So it is the main hormone is T3, which is the active form of hormone. T4 is converted to T3 before it is used in the peripheral tissues, and the it is the free T3 which is actually doing the job for us. So friends, we can now test it and do it out, but we had a lot of difficulties years before back, because we did not have the facilities to do T3, T4, TSH, and therefore we used to depend on PBI and radioactive iodine uptake. PBI is protein bound iodine. It goes parallel with the hormone level, and usually the level was, the upper limit of the level was about 10. So 4 to 10 international units was the 4 to 10 international units was the normal level of these hormones. But if it is more, it is hyperthyroidism. But if it is more than 16, it is extraneous contamination. And in my patient's case, this is exactly what happened. The result showed extraneous contamination, but we could not repeat it because the patient has been given radioactive iodine, and the effect of radioactive would disappear after about 1.5 to 2 months. So we could not wait it. I put the patient on neomercazole, 2 tablets 3 times daily, and the patient started improving over a week's period. She could do fine movements, fine work. This problem had completely subsided, and sleeping pulse rate was normal. So I must tell you here that sleeping pulse rate is the most important bedside test for checking, for making the diagnosis of a hyperthyroidism, because fast heart rate can occur because of anxiety, but when the person sleeps, the anxiety disappears and the heart rate becomes normal. But in hyperthyroidism, the fast heart rate is because of the thyroxine and T3, and therefore it doesn't disappear even during sleep. So if you find that during sleep the heart rate is fast, think of hyperthyroidism, not anxiety neurosis. So friends, we have other methods also, but I will not go into detail. It will become very lengthy. Hyperthyroidism itself is a very lengthy topic, and I have told you only briefly. So friends, I will sum up by saying that thyroid gland is in the neck. It has got right and left lobe joined together by small band of thyroid tissue called isthmus. Then the thyroid gland produces concentrates iodide in the thyroid cells and combines with thyrronine amino acid to form mono, di and triiodothyronine, and then tetraiodothyronine, which is the thyroxine. The active hormone of thyroid gland is the T3. T4 in peripheral tissues is converted to T3 before it is used. Both T3 and T4 are combined to a protein and circulate in the circulation, but the active, it can act only when it becomes free from the protein. When it is bound to the protein, it remains as a silent hormone in store. So these patients can be treated by medicine or by surgery, and we can now confirm the test, the diagnosis by measuring T3, T4, free T3, free T3, free T4 and TSH. So friends, this is what I wanted to tell you in short about this thing. But remember that deaths of patients in hyperthyroidism occur because of the cardiac causes. It may be coronary artery disease, or it may be heart failure, or it may be cardiomyopathy, or some arrhythmia causing cardiac arrest of the patient. Thank you very much. We will meet next time with another interesting topic.